We have a special speaker. I see Mayor Wu in the background. It's my pleasure to introduce our next speaker, Mayor Michelle Wu. I just want to say a few words. You know, when Mayor Wu came into office in 2021, many of my colleagues at that time were actually being disempowered. These are commissioners of public health around the country. They were being demoted, they were being removed from their positions. It was really a tragic time where there was a lot of misinformation, disinformation, anti-science. I want to say that Mayor Wu actually did the opposite here in Boston. She centered public health and really placed value in our work in a way that other folks weren't doing. So not just in regards to COVID-19, but certainly substance use disorder, mental health as a public health crisis, and other issues. And so she actually led by elevating the Boston Public Health Commission to her cabinet. And that hadn't happened in a long time. And she continues to prioritize public health. Her focus on schools, clean air, housing, improving the built health environments, so parks and bikeable roads, really show that she's a strong partner in creating a culture of health here in Boston. And her continued leadership will be vital to our efforts to advance health equity. So please join me in welcoming Mayor Michelle Wu.
Good morning, everyone. I am so delighted to see you this morning and so grateful for all the work that you do across our city and beyond. As you can hear, a cold from a couple days ago is still sitting in my childhood, asthma being triggered, and so I will continue to be drinking lots of water and sounding like I have a frog in my throat. But thank you so much for taking the time to be part of this very, very important convening, the first major gathering that the Boston Public Health Commission has held since the pandemic, and a time for you all to be thanked profusely, because I know it has been a very, very difficult several years on top of HERO's work long before COVID-19. Our administration, led by and driven by incredible leaders like the nationally renowned and fearless Dr. Bisola Ojikutu, and so many of our cabinet members and her entire team, our mantra is, we refuse to settle. We refuse to believe that things have to be the way they always were. And that means acting with urgency, that means driving forward with community at the center and focusing on people, because the solutions for how to solve seemingly impossible, seemingly intractable challenges are already right here in our communities. And that in some ways has always been the brilliance and the focus of public health, to take concepts that can be so wonky or complicated or based on statistics and numbers, and really connect that, at the end of the day, back to people, how people's daily lives are shaped, and the solutions that, in fact, so many of our community members are already bringing forward. Long before I had thought about running for office, I found myself walking up 5 floors of stairs every day to get up to the VOS 5th floor at Boston Medical Center. At that time, that's where the Medical Legal Partnership was based. And as a law student, I was trying to find ways to make meaning in a very difficult time in my family's life. My mom had been recently diagnosed with late onset schizophrenia. I had spent the last probably year and a half really flailing and struggling in how, as a 20-something-year-old, to begin raising my 2 younger sisters, who were 6 and 12 years younger than me. And so I have only come in some ways to politics because of lived experiences and family experiences that have seared into me a passion to try to do right and close the gaps when we have so many families who could benefit from services, who need the treatment, who are steps away from life-saving services, and yet feel so far away in a city where inequities persist, where the differences in how our residents feel welcome and whether they feel connected to certain of the amazing world-renowned care play out every day across our neighborhoods. My family story is one that shows how much additional to just the exact diagnosis and medical treatment permeates how families perceive and respond to and are able to access care. Stigma and the very significant and important cultural conversations and outreach that has to be part of all that we're doing. The entire family constellation and how issues of housing and work and educational access feed right back into whether medical treatment is actually going to be effective. I spent time at the Medical Legal Partnership working with clients, patients at Boston Medical Center whose diagnoses could not be treated without additional social determinants of health being addressed, whether that was an immigration law case or a housing situation, an education, advocacy situation, or something more. And so here in Boston, we are blessed. Every time I walk into a national meeting with mayors from across the country, I feel a little bit guilty because we are sitting and managing many of the same deep challenges, but with so many more resources here and so many more partnerships. And so I want to thank you all for being right at the heart of our decision-making here in Boston. Public health has to be the foundation not only for how we address issues, how we think about the lens on what we're doing, but also how we connect with our residents. We know that, for example, talking about climate in terms of sea level rise or in terms of how likely we are to, thank you, Dr. Hall. Talking about very important and urgent issues like climate in terms of the numbers or sea level rise or chance of a 1 in 100-year storm having an impact on our communities doesn't reach or match the urgency that our communities feel when you talk about it instead in the public health impacts felt immediately of air quality, of asthma, of pollution, of water quality, housing triggers that, housing conditions that trigger larger illnesses. And so we know that the work that Dr. Ojikutu and her team are leading in terms of reaching out to our communities, envisioning a world in which we're opening up doors to every single person in Boston and layering in health, social determinants of health, mental health, connection, building back our workforce. That is going to be the key to making Boston the city that is greenest in America, but also first for families. We dream and are building every day towards being a community that is going to be the best place in the country to raise a family, to have a multi-generational family living and stable and connected to community. And so that is what we fight for every day. That is what we rely on you all to partner with us on. And I'm so, so grateful for all that you do, all the ways that you are not only doing your professional work and involved in your own jobs, but taking the time to then invest in strengthening this larger public health community in Boston and wearing so many civic and volunteer hats and getting involved with us here at the City of Boston. So thank you so much for all that you're doing.